Alamin naman po natin ang latest sa findings ng Octa Research Group kaugnay sa pagbaba ng transmission rate ng COVID-19 sa bansa. Makakausap po natin si Dr. Guido David at si Professor Ranjit Rai. Magandang umaga po sa inyong dalawa at salamat po sa inyong pagpapaunlak sa aming imbitasyon.
Magandang umaga po sa inyo at sa lahat na nakikinig at nanonood po sa atin.
Good morning, Yusek.
Apo. Para po kung sino na lang po maaaring sumagot inyo po, may sapat na po ba itong isang linggong MECQ sa NCR Plus o mas makakabuti po kung mas mahaba pa o habaan pa yung quarantine classification na ito?
Sa aming pag-aaral, mas mainam talagang mas mahaba siya, no? Kasi napakataas po ng naging base of numbers natin. Yung number of cases po ay nagsimulang napakataas po na 5,000 kaso, new cases araw-araw. Ngayon ho ay talagang bumabagal na siya pero mataas pa rin at more than 3,000 cases po. So mas mainam talaga mas matagal yung healing period natin. Pero naintindihan namin, gaya nga nasabi ng mga iba yung panauhin, na talagang kailangan balansehin ang health at saka ang ekonomiya po. At yung balancing act na yan, para sa amin, on a weekly basis yan eh. So after next week po, we expect better numbers. We expect po na yung healthcare situation natin mag-i-ease ng konti. We also expect, no, pagka masustain natin yung R for at least a week at let's say 0.8, no, at lower than 1, makikita natin slowly bababa yung mga kaso natin, daily cases. So, of course, the longer, the better po kasi talagang we will solidify or stabilize yung downward trend po natin. So, si Professor David has some numbers. Baka pwede siyang, Professor David?
Yes, good morning. Thank you, Professor Ranjit, and good morning, Yusek, and sa mga viewers and listeners. Yeah, so what we're seeing right now, a significant improvement, and masasabi natin successful yung community quarantines natin for the past several weeks. Yung reproduction number natin bumaba from a high of 2, more than 2, ngayon nasa 0.85 na lang. Average number of cases sa NCR, 3,500. This is a 36% decrease compared to the peak natin, 5,500 average number. Pero and the positivity rate, 18% na lang, it's decreasing. So the numbers are trending in the right direction. Magandang balita yan. We have several LGUs na pababa ng cases with a 2 or 3 week downward trend. Pero sinabi nga ni Professor Ranjit, hospitals are still full, and based sa mga pag-aaral namin, they will still remain to be full. Mas maraming magpapa-admit as long as we're having more than 2,800 cases per day. So hopefully, in 1 to 2 weeks, mabababa natin yung number of cases per day natin sa NCR to mga less than 2,800. And by that, magsisimula na magkaroon ng easing sa hospital capacity natin.
Kung sino na lang din po maaaring sumagot dito, ano po, so gaano po kaya bago tayo pwedeng masabi natin magbuwag ng ating restriction na patungo dito sa GCQ?
Professor David could give the numbers here.
Yeah, sorry, Yusek, medyo hindi ko masyadong narinig yung question because of my connection, medyo unstable.
Dr. David, sa tingin nyo, gaano pa po makikagagal tayo pwedeng sabihin na natin medyo luwag na at pumunta na tayo sa GCQ. Okay pa po ba sa inyo kung 1 linggo, 2 linggo, o talagang medyo mas back po dito?
Yusek, yes, we understand na yun nga yung balancing act na gagawin ng national government to balance livelihood and yung public health. Yung sa easing ng restrictions natin, if we move to a more relaxed or flexible MECQ, for example, wala pa tayong datos dito kasi it depends on yung specifications ng MECQ and how it will affect the numbers. So pero we're hoping na even as we ease some restrictions, basta hindi yung mga activities that lead to high risk, and we respect din yung position ng Metro Manila Council to recommend na yes, we can open up certain businesses pero not yung activities that are of high risk, such as for example indoor dining. And although we support the restaurant business, sana yung mga kababayan natin will still continue to take out food or magpa-deliver para ma-support yung mga restaurants natin. So we hope na ito mga easing na restrictions, yun nga, hopefully will not lead to will be yun nga, calibrated, and it will be safe na hindi siya magle-lead to significant or to community transmissions or to increase in cases.
Alamin ang mga individual na ipagpapaliban muna ang pagtanggap ng COVID-19 vaccine. Mga may sintomas ng COVID-19. May exposure sa confirmed o suspected COVID-19 carrier sa nakaraang 14 na araw. Mga misis na nasa unang 3 buwan ng pagbubuntis. Tumanggap ng kahit anong klase ng bakuna sa loob ng 14 na araw. Na-admit sa ospital, nagkaroon ng atake o nagbago ng gamot para sa comorbidity sa loob ng nakaraang 3 buwan. At mga nakaranas ng hypertensive emergency o blood pressure na 180/120 pataas na may sintomas ng posibleng organ damage. Tandaan na bago bakunahan ay may pagsusuri munang pagdaraanan para garantisado ang kaligtasan.
Para iti umno. Husto ken alisto a panagipadamat.
Si kami, di mapagpiyaran. Para iti pagilian.
Nagpapatuloy po ang ating public briefing. Meron po, para po sa inyong tanong ito ni Joseph Morong, Dr. Guido and Professor Ranjit, pasensya na po kanina, paumanin po. May tanong po si Joseph Morong para sa inyong dalawa, i-extend yung MECQ but there will be more businesses that will open. Hindi ba siya counter intuitive?
Oh yeah. Well, the balance between the economy and the health concerns, brought about by COVID is real, and we recognize that a lot of people, especially those who are daily wage earners po, yung ating mga arawan na nagtatrabaho po, namin naapektuhan po talaga. So this was discussed at the level of the local governments po, the DTI. And gayon nga, yung ang amin hope lang is that the businesses that will open, that will be considered open during this modified, or this hybrid MECQ, ay hindi magkakaroon, magdadagdag sa super spreader events na, they won't become super spreader, or create risks, for spreading or further transmission of the virus. Mahirap talaga. It's a balancing act. Nai-recognize namin yon. On the other hand, ang suggestion namin is if we have a longer MECQ, we can heal po. We can stabilize yung numbers natin both at the level po ng reproduction number. We can also lessen the number of daily cases. Sa Octa po, na-estimate namin, if it's over 3,000 cases, mapupuno pa rin po yung mga hospital natin. Kaya kung mas matagal po yung ating healing period, yung exit strategy natin sa MECQ, maybe 1 or additional at most 2 weeks, makikita natin ho na talagang bababa ho yung daily number of cases po natin, bababa ho yung reproduction number natin, yung hospitals natin makikita mo luluwag talaga siya. And yun naman ang rason ho kung bakit tayo nagka-quarantine rin is to protect our healthcare system. So the longer po na we have this MACQ, kahit na modified siya, kahit na hybrid siya, ito na yung magiging exit strategy natin sa quarantine na to. And once we have 1 or 2 weeks of this, makikita natin we will have a foundation to open up to GCQ na mas solid, na talagang and solid enough for us to sustain for the next 3-4 months po. Tama-tama darating na yung mga bakuna natin. So yun po yung aming position sa Octa po, na talagang hindi pwede mag-transition sa GCQ as we speak, kasi it will yung trend po natin pwede mag-reverse. Pag nag-reverse yan, madaling magkaroon ng sitwasyon kagaya ng India po dito sa Metro Manila, na talagang grabe ang pagkalat at mapupuno at ma-overwhelm na naman po yung ating mga hospitals. Right now po, hanggang ngayon, puno pa rin yung mga hospital natin. Kaya kailangan talaga ng additional week, and after that week, mag-assess po tayo if we need another one. But definitely, it will take time po para ibaba yung mga cases na to. And we understand the adjustments being made. But as long as yung mindset ng ating mga kababayan ay ECQ mindset po. Yung ECQ, yung talagang nag-iingat tayo, hindi tayo nagpapabaya, hindi tayo nagkukumpiyansa. Okay? Maagap at maingat tayo. We are confident po na we will exit out of this quarantine towards GCQ with significant improvements po.
Opo. For Dr. Guido, baka meron kayong idadagdag. Pero ano po yung sa tingin ninyo? Kasi sa kasalukuyan tayo po ay nasa 8,000, 9,000 pa rin per day. Kailan po natin makikita na pwede ito bumaba ng 4,000 hanggang 2,000? Ito po ba ang mga datos na ideal para tayo po ay mag-shift na rin sa GCQ, Professor David?
Yes, Yusek Rocky. Yung right now, yung average natin sa national is less than 9,000 cases per day, so mga high 8,000, which seems like mataas pa. The reason is kasi mas malaking nag-improve sa NCR compared sa national. So before yung NCR, almost 50% ng cases natin nationally. Pero ngayon, nasa less than 40% na lang ng cases nationally. And right now, we're averaging 3,500 na lang sa NCR from 5,500. So yung ibig sabihin, yung sa national numbers natin, it seems na hindi ganun kalaking binaba. And that's because may mga regions outside the bubble na nagkakaroon ng slight increases or sometimes increases din. And that includes some parts of Batangas, Pampanga, and then also sa Region 2. And I think parts of CAR. So, pero yung numbers that we're hoping to see sa NCR na less than 3,000, it could be achieved 1 to 2 weeks, and then hopefully in mga 4 weeks we could be down to mga 2,000 cases per day sa NCR. Pag nangyari yun, we're hoping nasa mga 7,000 cases per day na lang tayo sa national. It seems high, pero I think we still have to address yung mga areas of concern outside the NCR bubble which are having an increase para rin mapababa natin yung national numbers natin.
Opo. Mula naman po kay Sweden Velado para po kay Professor Rai. Question po niya, our goal for reproduction number is less than 1 and recently bumaba na po ang ating reproduction number. Can we say that we are flattening the epidemic curve?
Ay, hindi pa po. We're very long way from that, no. And maybe that discussion won't be relevant for the next few months, no. But if we work at it, we can definitely slow down this epidemic here in the region. Ang importante ho, that's why we're asking for additional week or more for MACQ. Is really talagang to give time also for the national government to be able to implement, both national and local government, to implement their interventions. I think it's very clear, ang very sad experience natin with this terrible surge, yung pangangailangan sa testing, expanded testing, tracing, okay, okay, and isolation. And I think the national and local governments are already intervening. So the additional week or two will give us a chance, no, to hire our contact tracers, organize them. The additional week would also give us the local governments time to open up their new quarantine facilities. And of course, yung short to medium term, yung pag-hire ng healthcare workers, pag-expand ng capacity, itong additional week na hiningi namin ng MECQ, makakatulong talaga dyan, no? Lalo sa pag-reduce ng hospital capacity. Yung question about when to open, I think honestly we have to get cases below 2,000 cases. About 2,000 cases I think a day sa NCR we can manage po. Yun ang base sa pag-aaral namin sa Octa po. Anything over 2,000 cases ma-overwhelm po yung atin hospital system. And we have to constantly work together yung ating civil society, yung mga komunidad natin, yung ating private sector at yung government po, both local and national. Malaki hong hamon tong pag-reverse ng surge. Hindi ho siya mangyayari overnight. It will take us a month to get back to the numbers in January, maybe a month or two, to get the numbers down to the numbers we had last January. And that will require significant cooperation po from all of us. And so, importante ho yung governance ito. And when I say governance, good governance, I'm not just talking about government. I'm talking about the private sector. For example, ensuring safe workplaces. Marami ho ang nagkasakit sa mga workplaces po dito sa surge na to. Nakita natin na maraming nagdadala ng sakit galing sa workplaces. So, yung private sector ho, napakalaki ho ng role dyan in ensuring safe workplaces. Yung mga komunidad natin, yung pagsunod sa minimum public health standards, importante yung monitoring enforcement niya, dun sa mga komunidad natin. As citizens, tayo dapat mas maingat at maagap. At of course, dun rin sa atin mga local governments po. Importante, tuloy-tuloy ho, kasi hindi pa ho tayo, humina nga ng konti this week, hindi pa tayo, we're not out of the woods yet po. Pwede ho mag-reverse to. At pag magpabaya tayo, mag-reverse to, dadami na naman yung kaso. At mas mahirap pang sitwasyon kasi puno pa rin yung mga hospital natin. So yung hospital capacity, yung pag-expand yan over the next medium to long term, yan ang dapat goal ng gobyerno. Pero the good thing is right now, because of our collective sacrifice and our efforts, our shared responsibility and our cooperation and collaboration, bumababa na po yung numbers natin. And yun nga, gusto lang namin masustain sa Octa, masustain lang natin to for the next week or two. Whether it's in a MECQ or a modified or hybrid MECQ, this will really help improve our situation and condition. So both at the level of hospitals, daily cases, and whatever we achieved in the next week or two, yan ang magiging magandang foundation for the next 3 or 4 months na bukas tayo sa GCQ.
Opo. Tanong pa rin po ni Sweden Velado para po kay Dr. David. Dr. David, ito po ang tanong niya. Hirap po ngayon ang India sa paglaban sa COVID-19 and one of the factors po kung bakit tumaas ang cases nila doon ay variants. We also experienced that, but do you think the things that we did right and still doing in our country to contain the virus and variants from spreading further?
Yes, thank you, Yusek, and thank you for the question. Actually, we are doing many things right kasi the variants are not spreading anymore. In fact, nakakontrol na natin. So it happened many times sa parts of the country natin. Nangyari siya sa Cebu City and parts of Cebu. Nagkaroon siya doon ng surge due to variants. It was variant-driven. And na-control na nila after about 2 months. Nangyari din sa Mountain Province and sa Northern regions. Na-control din nila yung spread of variants. And right now, this is what we're doing in NCR. We're on the way to controlling the variants. Hindi pa natin masasabing flattening curve natin, but we are on a downward trend. And we have reduced the number of cases significantly. So at least from that standpoint, we're doing many things right. Of course, we still need to scale up yung testing natin, contact tracing, yung hospital care system, as Professor Ranjit said. Pero we are on the right path and we really hope this won't happen to us in India. We believe that it won't happen to us because we have systems in place to prevent that, a surge like that from happening in our country.
Opo. For Dr. Guido, nabanggit niyo po kanina na dapat na rin tingnan ang mababang hospital utilization rate. Sa ngayon po ba ay nasaan tayo pagdating sa hospital utilization rate? Malaki ba yung naging tulong ng mga modular hospitals at pagdating mula sa Visayas, dito po sa sinabing pagbaba ng hospital utilization rate sa NCR Plus?
Yes, Yusek, actually nag-decrease na yung hospital utilization rate natin sa NCR based on data from the Department of Health. Yung ICU occupancy natin nag-decrease na rin from about mga 80+%, ngayon nasa mga 70% na lang, mga 71% I believe. And then yung hospital utilization rate bumaba na, nasa mga 60% siya on average. Of course, ganun pa man, marami pa rin yung tao na nangangailangan ng hospital care, and may mga pila pa rin sa ibang mga hospitals. And malaking tulong ng ng pagpapadala ng mga healthcare workers from other provinces. Actually, kailangan pa nga natin yan eh. So we hope pwede pa natin madagdagan yung mga healthcare workers natin because dito tayo medyo nangangailangan talaga, mga healthcare workers, mga nurses sa NCR.
Okay. Kami po ay nagpapasalamat sa inyong panahon, Dr. Guido David, at kay Professor Ranjit Rai ng Octa Research Team. Mabuhay po kayong dalawa at salamat po sa pagpapaunlak niyo sa aming imbitasyon.
Salamat po, Yusek.
Thank you, Yusek.
Lahat. Mag-ingat po tayo lahat.